Welcome to today's program, and thank you for joining us. I'm C. Virginia Fields, former Manhattan Borough President and current President and CEO of the National Black Leadership Commission on AIDS, Inc. The mission of the National Black Leadership Commission on AIDS, also known as NBLCA, is to educate, mobilize, and empower black leaders to meet the challenge of fighting HIV/AIDS and other health disparities in their local communities. And today, we will discuss opioid prevention. According to the Center for Disease Control, drug overdose deaths and opioid-involved deaths continue to increase here in the United States. The majority of drug overdose deaths, more than 6 out of 10, involve an opioid. Since 1999, the number of overdose deaths, including prescription opioids and heroin, quadrupled. From 2000 to 2015, more than 500,000 people died from drug overdoses. 91 Americans die every day from an opioid overdose. The amount of prescription opioids sold to pharmacies, hospitals, and doctors nearly quadrupled from 1999 to 2010. Yet there had not been an overall change in the amount of pain that Americans reported. Deaths from prescription opioids drugs like oxycodone, hydrocodone, methadone have more than quadrupled since 1999. So here with me to discuss the need to improve prescription of drugs, expanding treatment of addiction, and reduce access to legal drugs is Terrell Jones. Terrell Jones is the Outreach and Advocacy Program Manager at New York Harm Reduction. He is a very passionate advocate, activist, and inspiration for drug users, sex workers, the homeless, and other marginalized communities. That's a mouthful about you, but I am so happy that you joined us because I understand that you are extremely passionate, and as you tell your own story, which I want to hear and have our listening audience learn a little bit about, just tell us a little about yourself before we talk about this issue of opiate prevention.
So as I stated, I was, former drug user. Takes me back, these memories, you know what I'm saying?
I can understand that, I can.
I mean, from using drugs, you know what I'm saying, to I look at the things that I've done in my life, you know what I'm saying, which was I was deemed a menace to society by the court system. Had kids, wasn't a father. But when I'm saying the fact that through my drug addiction, because I had some trauma in my life that was not addressed, was going unanswered, I was searching after and looking for help for that. And going into some of these abstinence-based drug treatment programs like Phoenix House, Daytop, Samaritan Village, these places didn't help me. You know what I'm saying? Because I'm not a junkie. I'm not an addict. I'm not a crackhead. I'm a human being.
And that led to your incarceration. And let me say to you, I'm so pleased that you were open enough to discuss it, because you had discussed it and you said that you would be, okay talking about it publicly. So I very much appreciate that. It's not always easy. And you talked about the fact that you had been incarcerated, and that basically led to turning you around, which was, I guess, in this case, a good thing, right?
I mean, when you're sitting there at Franklin Correctional Facility, a couple of miles from Canada, you know what I'm saying? And
you were way up there, right?
And then you're like looking at your life, what you need to do, and those moments just come. And I'm like, I can't go back out there and do the same thing. Got to do something different.
And that led you to becoming more of an activist,
right.
using your own life experience to not only improve yourself, but to try to change the lives of other people.
Exactly.
That is absolutely commendable, because reading your story again, you were very active in terms of getting the laws changed here in the state of New York, the drug laws, because so many people, unfortunately, who have negative experiences don't use it to not only change their own lives, their behavior, but to help others. So you're to be commended for that, and I certainly do want to congratulate you, and thank you so much for joining us. So the issue that we wanted to talk about today is this, what we're hearing a lot about opiate use, including from the federal government to the state to the local government. There's a great deal of concern and monies being put into budgets. What is opiate? Compare that to, let's say, when people talked about heroin.
Okay, so heroin is opiate. You're looking at anything that is derived from the poppy seed. You know what I'm saying? Anything that would normally put you in the down high, you know what I'm saying? That requires you to slow down your breathing, slow down your response system, you know what I'm saying? So those are the depressants that we call it, you said, and so those are what we call opiates.
So why is there such a difference now? I mean, because there's a great deal of attention being given to trying to put in place systems, whether it is centers or whether it is other ways to provide help to persons who are known to be opiate users, quote unquote. What's the difference that we didn't see when there was the heroin epidemic? It's all about drug use. This is a form of drug use, heroin a form of drug use, but we're seeing much more attention being given to this now. Who's the population?
Okay, now because you have individuals that are not only in our community, but individuals who are in the suburbs now being affected by this epidemic. But I'm going to be white people. Now that this has crossed over into their yards, it has become a problem. Now we are talking about having a softer and gentler war on drugs, because of the simple fact now is that it is crossing their community, and they are seeing what our community has been going through since the 50s, the 60s, and the 70s, the 80s, and the 90s. When we sat there and cried for help in our community because of the drug epidemic up there, which was not answered. We look back and see so many of our people died from heroin overdoses, and nothing was done. So now, because of this is hitting their backyard, they don't want to experience what we want to, and especially they do not want their children to go through the criminal justice system as we have went through.
And I can certainly understand that, and you talked about this being a softer and gentle approach. So the question becomes, how can we use this and make sure that those resources that are still needed in our community, and make sure that persons who are also victims get the help that they need? You see what I'm saying? So, and I agree with you, during the 60s, the 70s, 80s, straight through, to see so many of the people in our community out there on methadone never seem to be able to get off of even methadone. So how can we make certain that these, while they're softer and more gentle approaches, but make sure that they're in our communities?
And this is where it comes to our elected officials. This is when it comes to our community boards, also when the people in our community. Whatever is given to the white community, we have to make sure that we get it in our community too, because it would be unfair for them to get all of the new treatments, all this new money, and we get nothing. We still left the same way.
And I would agree with you to make sure that the resources come, but even not so much waiting to see what go into other communities, but making it known that these are the needs in our communities now. And since the resources are there, so, we aren't going to wait and see what's going over there. So we're going to say, the resources are here, and we want those resources here in this community.
And we have to make sure that we get them, because the simple fact again is that we won't probably get them if we don't open our mouths.
Now, that's true.
If we just sit back and keep waiting, as you stated, we're not going to get anything. So we have to be, as you say, a person that's hunger for this, because you know, I am tired of, like, I live in the South Bronx, and every day I come to work, I got to walk with my Narcan kit, because the South Bronx has the highest circulating overdoses. You know what I'm saying? And I'm tired of, like, walking by, seeing people that I know who have lost loved ones to this epidemic. I don't even know what to say to them anymore. You know what I'm saying? It's like, you know, this could have been avoided. This could have, these deaths could have been, these individuals still could be alive today, you know what I'm saying? Because when people want help who use drugs, sometimes they're scared to come because how people treat them. The stigma around the drug use. The labels that are put onto them, you know what I'm saying? And this is what stopped people from coming in to getting help. Because, like, if you go to the doctor, like, I went to the doctor and I had something wrong with my foot, you're not addressing what's wrong with my foot. You're addressing, oh, you got a drug problem. But I'm not here for my drug problem. I got some pain in my foot, doctor, that I need to be taken care of. But you want to talk about, oh, you need to stop using drugs, da, da, da. And then all the names that come along. How do you feel being a junkie or addict?
That is the situation that actually occurred with you?
Yes.
So what was the outcome? Did you ever get the treatment for your foot?
I left.
Oh, how dreadful. And so I'm saying,
but this has happened all the time when individuals may go
we
to the
do
doctor.
hear these stories more than we would like to know about.
Exactly.
You're absolutely correct that these are stories that we're hearing about. But see, this is the thing for me. These are the stories, too, that have to, you note on this show, we have a lot of back and forth. I have opinions, too, and my guests have opinions, so we just sort of talk, and that's fine.
Right.
Unlike a lot of shows you might get where the host is just supposed to listen, but, you know, this is too important, and so many other issues that we address. But what I was about to say is that these are the things that should get reported. And so often we have these experiences and we walk away from them and we never report them, so that doctor continues to do the same thing over and over again. So one of the things that I'm stressing is that when we have experiences and we know that they go against what that profession or that person, business or however, is supposed to be doing, we've got to start reporting it. We've got to make it known, whether it is to our network, our family, or organizations that we work with, so that we can try to change that behavior as well as those systems. Does that make sense?
Yeah, so that's one of the things we have been doing far as we, the individuals that work in harm reduction. We have been going out to train medical professionals on how to work with our population, people that are still currently using drugs. The language that is being used, look at the person as a human being. Don't look at them as a label. Because like I said, I don't like the word junkies, drug addict, and all that stuff there, because that just dehumanizes a person, you know what I'm saying? Give a person a little dignity and respect, you know what I'm saying? If this is the person's name, call them by their name. You know what I'm saying? You may get a better response than just calling somebody a crackhead or something like that, then boom, they're off the handle right then and there, you know what I'm saying?
And it's interesting because words, too, in terms of how we use them, can have racial overtones. When you hear junkie, the racial overtone or the association is generally thought about a person of color. When you hear now opiate user,
you think of
you
a
don't
white,
think of, right.
You think of a white person,
Yes.
because they're not going to call their own child junkies and crackheads and all these other names, you know what I'm saying?
But the persons are drug users.
Exactly.
So how do you think that do you find that using a harm reduction approach has significantly made a change in communities of color? And talk a little about, when we talk about harm reduction, what are some of the methods and the approach that we tend to think about?
So one of the things, like when I came in, being called by my name, asking what do you need help with at this immediate time, Mr. Jones? Do you want a cup of coffee? how's your family doing? Being treated like a person, you know what I'm saying? And just showing some type of affection, some type of love, you know what I'm saying? It was just like, I'm saying in my mind, okay, so what are they coming for afterwards, after all of this, you know what I'm saying? But when I came in and being treated with dignity and respect, seeing what I needed at that moment, that was like, you know, having me go through all of these issues, we want to address that right now, you know what I'm saying? And that was like, wow, I never came to a place where I felt that, you know, it was about me. Mm-hmm. You know what I'm saying? It wasn't about nobody else, about all the attention on what can we do for you. Are you ready to stop using? No. Okay, then what do you think you need help with besides? Well, we need to understand something. People need housing. People need access to medical care. You know what I'm saying?
And that might help a person decide
Yes.
that I also want to stop using drugs at
Right.
some point. But that might not be.
Right. But you know, for, you know, like people that have never been homeless, that have to survive out there and all these elements, they don't know what people go through.
I don't know, especially in this
Exactly.
weather that we've
You know what I'm
been
saying?
going
So
through
people have to survive out here, and they do whatever they need to survive. But like I'm saying, coming into harm reduction, having a person treat you with dignity, respect, you know what I'm saying? Talking to you like a normal human being, like you a family member, something like that. It like really opened my eyes to like, wow, you know what I'm saying? I never went to no place and they spoke to me like this. When I went to these other places, I was called all type of names. You know what I'm saying? I was, they tried to break me down till I couldn't be broken down no more. But how could you break me down when I was broken down to my lowest already? And I mean, like, it was just a hurting feeling going into some of these programs, but coming into harm reduction, being educated on HIV, hepatitis C, holistic therapy. I never had acupuncture in my life till I went there, and I found out how good holistic therapy is, you know what I'm saying? The groups that they have there, the mental health services, they have an array of services that they have for individuals that are former current users, you know. And also things like the language that's not being used. We don't want to call people those derogatory names. We want to call people by their name to show them that you are a human being.
So the approach involves a lot of different methods,
Exactly.
and including clean needles. I remember that was a major part of the whole harm reduction approach. Providing clean needles to persons who were using drugs, hopefully, obviously, to prevent the transmission
right.
of AIDS and any other
Bloodborne pathogen, yes.
right, blood diseases.
So just like you said,
transmitted
and that
diseases.
was like one of the things, because how we started taking care of our community. Because nobody else wanted to take care of them. You see, one of the things too, like people, you don't hear people talk about the Black Panthers and the Young Lords when they took over Lincoln Hospital, because of the trials and tribulations that people who were using drugs was having a problem getting access to methadone. And they had to literally go take it over so people in our community can have services accessible for them. But you hear only the negative parts of the Panthers and the Young Lords. You never hear anything about the good that they've done for our community.
I tell you, it's so much going on even today as we look at some of the situations that we're facing. Now, one of the things is that my organization, BLCA, was recently approved to be an opioid prevention site, which is, I understand, to educate providers and others to avoid overdose in their communities by doing some of the training that you spoke about in terms of use Narcan. And what are some of the ways that you think organizations as ours, mine in BLCA, can become more involved in the communities of greatest needs that we're talking about?
I think they're gonna have to unlearn all the stuff that they known before. Love somebody. Treat them with dignity and respect. Don't judge them.
These are the providers we're talking about now.
Yes, you know
like the one you went for your foot, even
right,
though they were not a
right.
provider for what you were looking
Right.
for, but
So,
they went to
yeah,
what they perceived
right.
your problem
You
to
can't sit there and judge people and make assumptions. You can't make an assumption why I started using drugs and try to tell me that, you know what I'm saying? Like I said, you want to go in with an open mind and treating a person like a human being. You want to give them some dignity and respect. Listen to what they have to say, because it's their story, it's their life. Because you haven't walked in their shoes, you don't know the feelings that they went through. 90% of what we do is active listening to what a person is saying, you know what I'm saying? So all the stuff that people have learned through the years about drug addiction and how to treat and all these new models that they come up with, no. Show some respect, show some love.
Just basic values
That's
that
it.
we've all. It's interesting that you would say that because, you know, as we read about all of this, et cetera, it is that what is the newest thing to do, and we're going to go down this path. We're going to down, and that, you know, research is valuable. Let's certainly make sure that that we understand that in terms of gaining better understanding about any problems and being able to apply response, whether it's a cure for something or more information. So science-based is very important.
Exactly.
We never want to ignore that. But at the same time, in dealing with people, as you said, make sure that it's just basic decency, respect for people, listening, being able to offer some level of compassion for what that person is going through, not stigmatizing them based on your own sense of what that means to be a person using drugs. So let's make sure we keep that incorporated with all of the science and the research and everything that we learn in order to be more effective. I think that's a good start right there. So are there any legislative, I know you're very active working on legislation. As an activist, as I said, I commend you for taking your own personal experiences and turning it into something that is obviously very much needed. Are you involved with any, in terms of your activism, any legislative policies that are under review as it relates to opioid prevention?
All right, so one of the main things that we are working on right now is supervised consumption facilities. Other people know them.
Tell us a little bit about what a survivor consumption facility is.
So other people may know it as a supervised injection facility. We want to change the name to supervised consumption spaces because we want people that use any type of drugs to be accepted in there. So here it is, you have an individual, you have a safe place for an individual to come to access all different type of services. It's not a place only for an individual to come use. There's holistic services, there's detox, there's case management services, there's holistic therapy, there's even if you want to go to rehab for 24 months or whatever, we would refer you there. So it's a whole variety of services for individuals to come in. And it's also a safe place to keep people off the streets, to not have dirty syringes disposed all in the streets, to have a place where individuals that use drugs could come in and not be out in the community. You know what I'm saying? So we are trying to provide an area for individuals to come into, but not just to use drugs, to also access services.
So how many of these survivor consumption facilities that we now have here in New York State?
None. We have none here in New York, but you have over 100 overseas. The closest one we have right now is in Vancouver, Canada. And my executive director, Liz Evans, is the young lady that opened up Insight up in Vancouver. She's now working as the executive director at New York Harm Industrial Educators and Washington Heights Corner Projects.
All right, because I did read something about the efforts in terms of trying to get more here and some of the work that I think AMFAR had done in terms of the research looking at the effectiveness of these centers.
They did a feasible study for that. The city gave money for a feasible study. We also did focus groups around the city with former current drug users. We also spoke to the groups with the community, you know what I'm saying? And right now, you know, it's more right where our elected officials, where we're really trying to like have them understand what this really is, because people in the community are going to listen to elected officials. And what we're trying to tell them, listen, you done tried all this other stuff, you done wasted all this money. When you look at the scientific data from the supervised consumption spaces and look at the lives that's being saved, There's no more criminal activity. Drug usage and all the stuff doesn't go up, you know what I'm saying? Crime doesn't go up in the neighborhoods. This is scientific data that's been taken from all these other places that's proved how effective these places are. So why do we want to go try something that we have no data or no information on when we have something right here that provides the data and the proof that this place works?
So that takes us back to an earlier topic that we talked about, and that is how do we get services in communities, Black communities, Latino communities, where the needs are great. So it sounds like we need to identify community-based organizations that are working with persons who are drug users, and identify those locations as potential consumption sites.
Because like we don't even have to open up a building or anything like that, you know what I'm saying?
But it needs to be an existing program, right?
Exactly. So like my program, Washington Heights, St. Anne's, Boom Health, we are existing harm reduction program where we can implement those things into our organization, bring those services there.
So it's just a matter of incorporating that into. So that's a pathway that we need to identify the communities that are serving a large part of the populations we're talking about. So as we advocate for these survivor consumption facilities, that this is where we will be directing those resources. And that's a very important way to help many of these communities that otherwise might be left out as the resources begin to flow.
Because you can look at like my agency, we have, one of the great things about our agency is that we are mobile. We don't wait for people to come to us. We have outreach team.
Go to where the people are.
Exactly. So we can set up mobile shifts in different areas at different times of the day. You know what I'm saying? You can also set up a shift if you want to just have one major building. But it's up to the community what they want and the people.
Clearly, there is so much to talk about, and I can't thank you enough for joining us. But unfortunately, we're out of time. But I can tell you this dialogue is going to continue because it's too important to let it just end there. So I invite our viewers to learn more about NBLCA, to visit our website, NBLCA.org, and also look for NBLCA on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. So please let your family, friends, and neighbors know about this programming. On behalf of myself and NBLCA, I thank you for joining us and hope you'll tune in next time for NBLCA's Health Action TV right here on Manhattan Neighborhood Network. And thank you, Terrell, for joining us.
Thank you for having me.